This is a long game. We're working with these families for a really long time. And what the data tells us is that not only do we get really great outcomes while we're there in the homes working with families, getting their immunizations, getting their medical care, all of those things in that first 2 years, but then extending the outcomes of that service for many years to come.
The American Rescue Plan Act was signed 3 years ago in 2021 by Joe Biden into law. $1.9 trillion, historic resources for local governments to reimagine communities across our country after COVID. Here in New Castle County, our government decided to make unprecedented investment in children, and particularly their mothers, poor mothers giving birth for the first time. Nurse Family Partnership is a program that's had historic success for generations. We work to expand it here in New Castle County. Hear how we did it, and hear how we did it actually without using any public money up front on today's Pod County. Hi, this is Matt Meyer. Welcome to Pod County. There are problems of injustice, inequality, violent crime, kids not performing the way we think they should or could in school. We're going to talk about something really innovative we are doing and Children's Family First has been doing across Delaware for over a decade. We're talking about it today. It's called the Nurse Family Partnership. Some say it's the most effective, data-driven anti-crime program in the history of the country. We've increased it in size by about 30-40% here in New Castle County. I have Kirsten Olson, the Executive Director, CEO, President, leader.
All of the above.
Of Children and Families First here with us, along with Char Patibanda, the General Manager of Land Use, the first person of color ever to serve in that role. Before that, she was in charge of economic development, which is kind of interesting. As the head of economic development, she took on this project. And in addition to the tremendous services that the Nurse Family Partnership and New Castle County are providing to first-time expectant mothers and their families, Char structured it in a very unusual way, pay for success that actually from the outset have cost taxpayers $0. Taxpayers will only pay for this if it actually works, which is an incredible thing, never before done in county government. I think it's the second time in the history of the state anything like this has been done. So that's what we're talking about today. First, Ms. Olson, let's talk a little bit about Children and Families First, the organization you're coming from, the critical role it plays in Delaware.
Sure. Thanks so much for having me. This is a really exciting topic, and happy to talk about it, and always happy to talk about Children and Families First. We are a nonprofit organization that has been operating in Delaware since 1884. So we're coming up on our 140th anniversary, which is a huge deal. And I love to think about the people who started this work 140 years ago, and if they're looking down on us, which I hope they are, that they think that we continue to live their vision and their mission of making Delaware a better place for kids and families. That's really what we're all about. And we do that in a whole host of ways across the lifespan, really looking at how we can be effective in preventing childhood trauma, preventing abuse, and then intervening when we need to do that through so many different ways, one of which is the Nurse Family Partnership, which is targeting first-time pregnant folks and new moms to get them what they need so that their kids can be successful. And that's just one of about 15 different things that we do across the state.
Fantastic. And thank you to you and your staff for what you do every day for Delawareans. I think not enough Delawareans know about the tremendous services that Children and Families First provide, particularly in communities devastated by poverty across our state, urban, suburban, and rural. So thank you. Nurse Family Partnership. Talk a little bit about, it's a national program. I first was taught about it almost 20 years ago from a college classmate of mine who's a medical doctor who said, if you want to solve crime, Nurse Family Partnership long-term does more to address crime than, I'm like, that doesn't, it's first time, it's helping first-time expectant mothers. I thought you were going to say more police. So let's talk a little bit about Nurse Family Partnership.
So the Nurse Family Partnership is a model that has been around, I think, more than 40 years now. And one of the things that's really exciting about it is that it is evidence-based, that they've been building this body of data and evidence across many decades through randomized controlled trials, really the blue ribbon approach to proving that your model is effective. And we are working with first-time pregnant moms who enroll in the service during their pregnancy, so by the 28th week. So, thinking really deeply about that prenatal period and making sure that we're getting folks early so that we can have the best impact. And then serving those moms and their children until the child turns 2. So this is a long game. We're working with these families for a really long time. And what the data tells us is that not only do we get really great outcomes while we're there in the homes working with families, but that there is at least a 15-year post effect. So some of the things that you were talking about around crime reduction, around moms getting back to work, moms improving their economic outcomes, children having better school outcomes across their school career. So really strong impact, not only around having healthy babies and having kids hit those early developmental milestones, getting their immunizations, getting their medical care, all of those things in that first 2 years, but then extending the outcomes of that service for many years to come.
So you said this is like over 40 years old, data-driven, evidence-based program that shows results. So why isn't everybody doing this everywhere?
I think there are a couple of reasons. One, it's not cheap.
Mm-hmm.
We're using highly trained registered nurses to deliver the model. So that's not an inexpensive way to deliver a service. And because it's evidence-based and really rigorous around the fidelity to the model, there are a lot of other costs around making sure everyone's trained in the model, making sure that we're collecting all the right data, making sure that we're keeping caseloads low enough that we can have that strong impact. So I think cost is certainly an issue for folks in delivering the model. And then even when we're delivering the model, really penetrating the communities where we need to be, finding the moms that could really benefit from the service, engaging those moms and being able to kind of build that service array for them can be a challenge.
I have in the back of my head from 20 years ago, if I ever have an opportunity, Dr. Collins, my friend, told me nurse-family partnership is the way to go. Char, we're in county government. We provide public safety service, police, paramedic, 911. We do land use. We're in charge of the sewers, libraries, parks. And then COVID happens, and we get resources from the federal government to look at a little bit more broadly at our mandate. Why do you think, of all the things to invest in post-COVID, why do you think this is important?
When COVID happened and I joined the county as economic development director, we were looking to provide solutions for women who were particularly disadvantaged from the pandemic. We looked at lots of things like lack of childcare, just people in general being afraid to go to the doctor in order to receive care out of risk of contracting COVID, and that really did affect women who were pregnant as well. The federal guidelines for some of the funding that we received under ARPA actually called out home visiting models as eligible programs that could receive this type of funding. And so, yes, it's not generally in the county's purview to look at maternal health care and early childhood, but I think due to really your leadership and thinking outside the box, because we needed to do more for these moms. We knew that they were not getting the care they needed. We knew that they may be just too scared to even get a checkup during their pregnancy because of what was happening during the pandemic. And we knew that there are several hundred moms in Newcastle County that were eligible for this program, but were not getting it. So I think the idea of thinking outside the box, a little bit outside of what the county normally does, but at the same time, not really, because if we do care about the public safety and health and well-being of our communities from a land use or public safety perspective, we have to care about moms. We have to care about women being able to come back into the workforce. We need to make sure that kids, when they enter school, are healthy. And there were a lot of things that the county were considering, but this particular program being called out in the federal guidelines and then kind of looking at it from a unique perspective, like how do we prove to the taxpayers that this is the right investment? And I think that under your leadership with the Pay for Success model, this started to become a reality. And just from a personal standpoint, my mom is a pediatrician. She has served in Newcastle County for her entire career, and I know how important it is to help babies. And if babies are helped in 0 to 1 to 2, that is how they can thrive the most. So from a personal viewpoint, I believed in this program 100%. And I asked her about it. And I said, what do you think of, nurses coming home to visit moms during pregnancy and right after childbirth? And she said, my God, that's the best thing that could ever happen for the mom and the baby.
And so we started to look at this. I think we were in strong agreement that this is an amazing program. In most cases, what you do at that point is you allocate government money and you pay for it. I think we looked at it a little bit differently. We said this is an expensive program. These highly trained nurses need to be compensated well for it to work. And what we want to do, instead of just doing it one program for a couple of years and then the money goes away, let's do a pilot and let's try to do it where we only spend money if the program works. Can you talk about who are our partners? How do we make this happen? And what is Pay for Success?
Sure. It's a great question. I had to Google it myself when you brought it up. So Pay for Success is the concept that governments can partner with philanthropy to create funding models where the taxpayer dollars are withheld until certain outcomes or metrics are met by the program. So some people think, oh, that really disadvantages the nonprofit who's doing the services, and we would never want to create a model like that. So what actually happens is that the philanthropy, in this case the Longwood Foundation, who is an incredibly willing partner, and really we couldn't have done this without them, they would front the costs of the program, take on the risk if that program didn't actually work, and then if the program works and the outcomes are met, the county government would then issue a reimbursement to the Longwood Foundation for program success. So the way these contracts are written is, from my perspective, very unique as far as government contracts go. They have some flexibility in them. We have a built-in executive governance board. There's also a management board. And these boards make the contract a living document so it can be adaptable. Because I think the last thing government should be doing is locking themselves into long-term contracts that aren't working. I mean, that's just a waste of taxpayer dollars at the end of the day. So Pay for Success gives the government some assurance that what they're doing, what they're funding, is actually working. In this case, after 40 years of data-driven evidence, we know that the program works. What we needed to figure out is how do we get more moms to sign up and how do we get more moms to stay in the program. So some of our outcome measures are really targeted toward that type of outreach. And it has allowed CFF, Kirsten and her team, to really think outside the box for marketing. I mean, we're talking about social media, we're talking about getting Spanish-speaking influencers involved, and whatever we can do to reach the population and make sure they know that these services are available to them for free.
We can even do a podcast and tell people about it on Pod County.
An amazing tool.
So let me summarize for a minute. So we have Nurse Family Partnership, with Children and Families First. I think Leslie Newman started with 100. They're doing about 175 mothers annually, approximately.
Somewhere between 175 and 225.
225 across the state. Mm-hmm. Matt and Char talk and say, hey, we think based on the data, this would help Delaware and probably eventually save a lot of money if every month, though it's expensive up front, it would save a whole lot of money if every first-time expectant mother on Medicaid had an opportunity to have a nurse like this visit their home. And so we came up with the idea, instead of spending public money, we're going to use this Pay for Success. We brought Longwood Foundation in, and thanks to their work and their investment, they invested the money to expand this program by 120 mothers in Newcastle County, because that's our mandate here in Newcastle County. And then if these metrics are hit, then the county government, the county taxpayer, will pay back Longwood, which makes sense, of course, because there's a tremendous financial savings of having mothers go through this program. And so that was the model. I think we announced it, was it over a year ago that we announced it, thanks to the collaboration of the majority of Newcastle County Council. We were able to move forward. And how's it going?
It's going great. Char mentioned there are some benchmarks that are tied to the release of the funding, and we started staffing up towards the end of 2022. So started to be able to enroll families in early 2023, and our benchmark was to enroll 30 moms by the end of 2023, and we hit that 30 benchmark in October. So we have
early.
achieved that benchmark just a snooch early. And now we've had some deliveries. I think we've had 9 babies born from those
Awesome.
families that have enrolled, and are starting to see some of the early benchmarks around retention, around breastfeeding, around child development assessment. So as time goes on, we'll start to get more and more data about what's happening, but the early signs are really positive.
So how does this actually start? So a nurse, it starts before the baby is born.
Yep.
And so how do mothers even find out about this?
There are lots of different ways, and Char touched on the really important aspect of outreach. So because we've been doing this service for about 10 years, there's a pretty robust outreach mechanism. But a lot of our referrals, moms find out about it from their obstetrician. They may find out about it from their Medicaid managed care provider, may make a referral. They may work with a community health worker at another organization who may refer them. They may have a friend who participated in the program who says, hey, this was a great program, you should really look into
or
it.
a sibling or family member.
Right, anyone. So moms can self-refer. But I would say that their docs, their Medicaid providers are the kind of top referral sources for moms to find out about it.
And if I'm at 8 weeks, 10 weeks, 20 weeks, 38 weeks, is there like a target when we're trying to get mothers enrolled in the program?
So because we're trying to have strong outcomes around that healthy pregnancy, healthy delivery, Delaware has historically struggled with our infant mortality rate, particularly for these moms that we're targeting, moms who are living in poverty, who have other kinds of factors that are working against them. So the goal of the program, or the program requires that moms enroll by the 28th week of pregnancy. So thinking about a pregnancy is 40 weeks. We're looking, those first 2 trimesters to get moms in the door.
And I should mention that I talked about the boards that, we meet regularly to talk about the program. That actually, the boards include moms. And so we have a little baby that joins our calls sometimes. And so it's very important to get actual feedback from mothers themselves so we understand, why are people dropping out of the program? Why don't they want to stay? Right now, our retention rate is actually quite high. So the fact that we're measuring this data like this in this way is, really kind of novel and will help expand the program further. That's our hope.
You two have heard me say many times, this is a pilot. How do we offer this for every first-time expectant mother living in poverty in Delaware?
I think our timing for this project couldn't have been better. So for many years, the services that we've provided have been provided under contract with the Division of Public Health through a combination of federal and state funds that support the work. But there has been advocacy over the years around having home visiting, including the Nurse-Family Partnership, a covered service under Medicaid. And in October of this year, so last month, a waiver was approved by the federal government to allow home visiting, the Nurse-Family Partnership included, to become a covered service. So ultimately, all moms who are enrolled in Medicaid through one of our managed care providers here in Delaware will have this as an eligible covered service. So we're working through that whole process right now, but to me that's both the sustainability pathway, thinking about the time-limited nature of the work that we're doing, but also that effort to expand this across the state to anyone who is eligible and wants to participate.
And then it's just a matter of us working with you to market it so that
finding those folks.
Yeah, because it'll be covered. That's fantastic. That's very exciting.
And I think, too, community members and residents in the state need to know about why this program is important and have them prioritize it when they call their legislators and they call their, local representatives and say that this is how we want our tax dollars to be used. And now we have data to prove that the tax dollar usage is also going to be effective, hopefully, by the end of the program. So I think that having the community support is also very helpful.
And I just want to, thinking back around the referrals, I would be remiss if I didn't mention 211. So the state's 211 system is very skilled. They understand home visiting. They understand the eligibility requirements. So when a referral is made through that 211 system, whether it's a mom calling herself or whether it's a provider reaching out for services, 211 will get folks to the right place every time.
So it's something like somebody, either a mother or provider, calling saying there's a pregnant mother who needs services, help. I see.
Yep.
Amazing. This is incredible. I mean, my job is the best when we're able to help the most vulnerable among us with really smart and meaningful programs. And I know Children and Families First, not just with Nurse Family Partnership, but with a whole host of programs, is doing that every single day. So thank you for that. We also owe a debt of gratitude to Social Finance Longwood, who I mentioned, and actually Dr. Kara Odom Walker as well, the former Secretary of Health and Social Services, who was passionate about this program in particular as a pay-for-success model before the county even entered the scene.
She serves on our boards too.
Good. Currently at Nemours. Char, can you touch on this pay-for-success? So this is one way we're applying it, right? For a private partner, Longwood, to come in and make an investment where the public, we pay zero taxpayer money to see if this works. And if it works, we pay, and if it doesn't work, we don't pay. Are there other ways we could use pay for success?
Absolutely, and I think Pay for Success is really meant to be for large-scale, statewide type of programs, and we needed to pilot it on a smaller scale to prove the case in point to show the public that this type of modeling, though a little bit complicated, and thank you for mentioning social finance, because we absolutely could not have gotten through this without an intermediary like them, who is knowledgeable not only on the services side, but also on the contractual legal side and the government restraints as well. So these programs are meant to be large scale, and the philanthropy community can invest in these types of programs, because at the end of the day, all of our goals are aligned in that sense. And so I think this can be provided for many other social programs, some of which have a long lead time to understand the data, and we have a lot of learning outcomes that are going to go past the federal funding deadlines, but we're going to keep looking at this. And I think that if more contracts were structured this way, then taxpayers wouldn't feel frustrated when the same problems keep happening over and over again, because the government is really looking closely to see what is working, what is not, what is waste, and what, where's the data, where's the evidence, and let's put the money in those programs.
To put you on the spot here, Kirsten, do you think there are other Children and Families First programs that lend themselves to pay for success models?
I think there are. That is definitely an on-the-spot question. But because Children and Families First does a lot of evidence-based practice, and I think that has been crucial in structuring this project, is that because Nurse Family Partnership and their National Service Office has also been a great partner to us in this, they've got reams and reams and reams and reams of data, and so we have some understanding of what to expect. So as we're structuring what we think those outcomes will be, that data has been really crucial. And so because we as an organization do a lot of evidence-based practice, I think there are other places where we could apply something like this and really think about how we bring those public-private partnerships to bear and how we look at payment for outcomes.
Because also a lot of what you're doing at Children and Families First, we're making sizable investments that are actually just purely financially, which is not the best way to look at Children and Families First service, a very human service, but making big investments, hundreds of thousands, sometimes $1 million investments in programs that provide a tremendous 10 times the financial return, but is not realized for 5, 10, 15 years, right? And so it seems and usually governments have a higher tolerance to withstand sort of the test of time than the private sector does. So I think it's very interesting.
Yeah, although I do think sometimes it's hard for a legislator of today to understand the return on investment for the legislator for 10 years from now. And so I think that's part of the messaging, because Nurse Family Partnership is a great example. The return on investment is huge, dollar over dollar. I think, I'm not looking at the data, but it's probably $7 for every dollar in the front door. Mm-hmm. But the lead time is long. That's a long time to recoup that investment. And so being really honest with ourselves about what that looks like and how long this takes and what we expect to achieve is, I think, really important part of the conversation. And you all have been very understanding of those long-term mm-hmm. gains and those long-term benefits.
And again, that's where the data validation, the data completeness comes into play here, because legislators should not be thinking too emotionally about this. If they see data results, then they should feel confident that the investment will give that return, right? I mean, that's what data is supposed to do. So informed decision making like that. So agreed, it is really difficult for someone to see that far in the future, but hopefully we're making the case with the data.
Quick shout out to President Biden, Senators Carper and Coons, and Representative Blunt Rochester. Without them, without the not just the financial support, but the regulatory support. Char mentioned on several occasions just that it's in the regulations, home visiting for nurses, pay for success. Luckily, these post-COVID monies were written such that it was pretty easy to do this, when in prior times it would have been nearly impossible. So thank you to them, and thank you to both of you. This never ever would have happened with each of your passion for this. I know it's a job, but for you it's more than a job, and it's actively helping people right now. 30 mothers, and God willing, another 90 on the way. So thank you.
And thank you for your leadership.